In this video, I'd like to just explain some of the symptoms that I have. Hopefully we can work together and solve some of them. Normally I went to a neurologist and he saw a bunch of symptoms, came up with a diagnosis, PLS, primary lateral sclerosis. And there's no definitive test for this disease. You just see a whole bunch of symptoms and come up with some diagnosis. Then of course they have nothing more they can do, send you off to a physical therapist. First question the physical therapist will ask is, what did the doctor say? The doctor has no input at all except to say, you have PLS. So the physical therapist is left in a bit of a quandary because there's several symptoms, but there's no underlying diagnosis to say what might be the primary cause, what might be the effects of that, what is the way that the disease has progressed, what might have been first. And so you're left with just treating some symptoms that may be the effects of some underlying cause, and you never get anywhere. So what I want to do today is just go over a few of the symptoms without coming up with a story about what came first and how to solve it. And it may be that the best therapy is just some whole body exercise in which you try and treat everything altogether. I've had success more in doing that rather than trying isolated exercises, but in any case, nothing has proved particularly useful. Now, there are two major symptoms that are primary to PLS. The first one is hyperreflexia, right? So you take the knees, they go crazy. So you know right away that there's some neurological problem going on. The other symptom that is harder to get, that it takes the person to say it, you can't really see it, is hypertonicity of the gastrocnemius. And that's hard to explain. It's slowly improving or getting worse, and it feels very much like a really bad sunburn that doesn't go away. And you don't take a painkiller for that. It is a pain, but if the model is like a sunburn, then what you want is topical relief. And that's why when people go to neurologists and they have this problem, they get Botox. The problem with Botox is that it works for a month or two, but by the second or third treatment, it's not really working anymore. So a temporary solution, and it doesn't really work. But those are the two primary symptoms. They, in turn, give some kind of spasticity in the lower extremity. What I have read, and it seems true to me, is that the spasticity is a sort of velocity-dependent restriction of motion. Now, I think that it may be that, I'll get to it in a minute, that there are some muscles that exhibit this kind of spasticity, but without velocity dependence. So it may be that the definition of spasticity may not include velocity dependence, but it's certainly true of bending the knee, that I have that kind of spasticity being velocity dependent. But on the basis, I think, of the very tight gastrocnemius, which then tightens and shrinks, you have a range of effects that come from that. Soleus becomes tight. The tibialis anterior seemingly doesn't function very well. And of course the hamstrings then moving up the leg have a problem. Now, one of the, in the literature, there's something about weak tibialis anterior, that if the gastrocnemius is weak, then the agonist on the other side of the leg must also have some effect. And this causes one of the symptoms I have, which is the lack of dorsiflexion in the left foot. So the literature says that one of the problems that occurs by hypertonicity is that the tibialis anterior ceases to work, or it becomes weak, and therefore you can't dorsiflex. Uh, the problem I have with that is that I have hypertonicity in both the left and the right gastrocnemius, but I can dorsiflex the right foot. So it doesn't seem to me that the lack of dorsiflexion due to a weak tibialis anterior is solely due to the gastrocnemius being tight, because I have tight gastrocnemius in both legs, but only the left foot doesn't dorsiflex. So to me, there seems to be some other reason why I have a problem with dorsiflexing the left foot. Uh, I think something that a superficial examination doesn't show is that I have an enormous amount of tension that goes from the glute on the left leg all the way down to the toe. And one way to, I think that I can help explain the lack of dorsiflexion in the left foot is if you look at, imagine this is my left leg, and or the right leg that I can dorsiflex without any problem, right? And everything is, I'm holding the leg normally. But now if I try and put as much tension that I possibly can into the left arm here, you can't really see that I'm doing that, but I am. And in putting as much tension as I can into the arm, I find that I can't really dorsiflex or move at the wrist. It's too tight. But if I ease off on that tension, I'm back to being able to do it. And I think that's what's going on in the left leg. I strain to move, dorsiflex the left foot, but I can feel at the sole, going down the back of the leg and then up in the sole, an enormous amount of tension. It's like a thick pad has been glued to it. And so the foot cannot dorsiflex, but it's not so much feeling weakness in the tibialis anterior that I'm feeling weak, oh, I can't move it up. It's that I'm struggling against an enormous amount of tension. I've explained that to physical therapists, I've explained that to the neurologist, and I just get a kind of, good luck to you, pal. I don't know how else to explain that, but it is true that I cannot dorsiflex the left foot, and that's again one of the symptoms. I have been fitted 2 years ago with a brace, and that was supposed to be sort of a foot drop brace, an ankle foot orthotic, AFO, monstrous thing that was at great expense, custom built for me. The problem is it was so big that it required a shoe 2 sizes too big. And so if it was supposed to help foot drop, but then you've got a much larger foot, it seems to me completely misconceived. Plus, I was recommended to have it for a long time, but I resisted it because it's not that I could lift the leg a little bit and then it would foot drop would occur. I have to move the leg to the side to move forward or go upstairs because I can't lift the leg up at all. So putting a heavy brace with a large shoe did not do a thing to get me to walk any better. So the lack of dorsiflexion is of the left foot is one of the big symptoms I have. My toes are, this is something that you find in people who have spasticity. The toes are very much, or maybe I do it this way. The toes are very much curled. They're not full hammer toes, but they're kind of curled. And I can do this with the toe, but I can't do these with the toes. So they're rigid, but not rigid. You can move them, you can lift them up, and they're very flexible. But I can't do it on my own. They're not strong enough to move that way. But I have some feeling, and I can sort of do this with them. So curled toes is another problem. Another problem is that the left foot only goes out to the side, and that thrusts the knee inward, and that makes walking very difficult, puts a lot of strain on the knee. So the foot goes to the side, and also edema is present, mostly in the left foot, on occasion in the right. And I had it explained to me, makes sense, that the circulation is lessened because the tight gastrocnemius is preventing some blood from flowing back. Whether that's the actual explanation, I don't know, but the edema is not as much of a problem as the fact that the foot goes that way. And I've had that explained to me as a soleus problem and as a hip adductor problem. I don't know what it is, but it definitely, along with the dorsiflexion, makes it difficult to do any kind of walking. Again, I'll have a video coming soon enough that will explain or show, how I walk or do something that resembles walking. Another interesting thing is that on the soleus, on the outside of the left soleus, there's many trigger points, very painful. If you touch them, it's just very, very painful. But an interesting thing is that if I use a foam roller or if I cross the leg up on the right thigh and hit those trigger points with the bony part of the right knee, I can, after a minute or two of pressure on those trigger points, the left foot will dorsiflex, spasm up like this, and then ease back, and then it's almost immobile again. So I think there's a something to do with those trigger points in the soleus, that it has something to do with the dorsiflexion rather than the tibialis anterior. And again, it goes to the story about the enormous amount of tension that I feel throughout the left leg. Moving up the leg, two problems that are probably the most severe right now is a tight left glute, a knot. I've done an enormous amount of glute exercises. I could feel that the left glute is approaching the strength of the right one, but there's a trigger, not trigger point, but a definite feeling of a knot, and it feels like a hill, right? So if I go on the right glute, I can go and bend over and put all my weight on that left glute. Really not a problem. If I move over, I'm in the right glute. If I move over to the left glute, feel, again, I'll have a video that'll show this a little better. I feel like I'm going up on that knot now. And if I go over further, I fall over. That there's on the other side of that knot, there's no ability to hold myself up. And then probably the major problem is the left hip adductor is very tight. Now this could be spasticity due to the PLS. It could be simply over the course of a couple of years that it's slowly gotten tighter. I felt it a couple of years ago, and it's slowly built. It's not a sudden thing. It's not an injury. It's just built up over the past couple of years. The same with the knot in the glute. That is a slowly evolving problem. But right now, it's probably the major reason why I have difficulty standing and walking at all. It's not the left foot. It's not the dorsiflexion, because I've had that problem for several years, and I was able to kind of get myself to work and get on subways and go to work even with that inability to lift the leg. I would just, I forget the word, circumflect it, move it to the side and come back. It's the way I go upstairs now. But I was able to walk, but the glute and the left hip adductor, that group of muscles is now very, very tight. I can't say how many exercises I've done, how many times I've gone to physical therapy and they put me on the damn hip adductor machine. I try to isolate and do that. It doesn't work. And I'm not sure what I can do, if it's a spasticity that's due to the disease. I'm not sure what I can do about it. I can do exercises and free it up a little bit, get some range of motion, but then I go to bed and it tightens up, and the next day it's as bad as ever. So I'm at a loss to know what I can do for both that and for the glute and the knot in the glute, what I can do to get rid of that. The weakness also goes up the left side a little bit. I don't feel it. I feel the weakness only when I try and lift my shoulder. I've looked at shoulder exercises, and I'm not sure, I mean, at what point I'm shrugging my shoulder to get up, what kind of freeness I have. I try and do a lot of them. This is the weak shoulder here. I'm not sure, I guess that's I can do that, but at what point am I shrugging the shoulder? I'm not exactly sure. I do feel a little bit of numbness here because it's not a carpal tunnel thing. It definitely is something that's going down from the side and coming up and going out. So so it's all related in that way. It may be that the PLS is directly affecting, besides the gastrocnemius, some iliopsoas muscle group. I'm not sure. There's been, in the literature, there's some sense of that. It may be simply due to two things. One, that many years of trying to walk and to gain balance, they kind of move forward, so you've gone forward, and then being so many years at my desk for so long that I'm just constantly bending forward, and so there's some problem with the iliopsoas not being able to straighten up. I do have a stiff back. It doesn't hurt. I have no pain anywhere. The lumbar the MRIs do show that there's a lot of crookedness going on, but there's no impingement of anything. But if I try and bend backwards, I don't have a lot of range of motion backwards. I have a lot of flexibility. I can touch my wrists to my toes, but I can't bend backwards very much. And the big thing is I have no strength. That I have flexibility, but I don't have a lot of strength. So those are the series of symptoms that I have. And in a couple other videos, I'll demonstrate how I try and get around, and how I go up steps, how I walk, demonstrate the spasticity, and I hope that that will be enough to, along with this set of exercises, a set of symptoms that will, help kind of give us some kind of therapeutic, you can help in some way to relieve some of this. And anyway, I look forward to that. Let me give you a couple of other videos after that, after this introduction.